By tracking the careers of women in medicine in Philadelphia, we see the broader themes of how medicine, the identity of clinicians, and medical education have become professionalized and standardized over time. We view these changes through the lenses of the first clinical courses in midwifery, the first women's medical college, and an organization for advancement of women in medical education.
Before 1850, formal medical education was routinely forbidden to women. However, the practice of midwifery had existed as a recognized female occupation since ancient times. Still, for most of history, its practice was largely unstandardized and unempirical. It retained an identity as a practice based on tradition and folklore, and historically was not considered a formal medical profession. By the mid-18th century, however, medical schools debuted the controversial practice of lecturing and providing formal training in midwifery. Of critical importance, at Penn School of Medicine, these courses were open to both men and women. Before women's medical schools were established in the second half of the 19th century, this was a single medical area in which women could receive formal clinical training. William Shippen, Jr. was a lecturer in Penn's medical school in the last half of the 18th century. In 1762, Shippen began to deliver a series of lectures on anatomy, surgery, and the practice of midwifery. His were the first to make use of anatomical drawings and dissections for training in the field. Despite opposition, by 1765, Shippen offered a comprehensive course in midwifery to both women and men. He was elected professor of anatomy and surgery in the medical department of the College of Philadelphia on September 23, 1765. Although Shippen's courses were criticized by both males who found the idea of men in midwifery repulsive and females who mourned the loss of traditional practices, his work was critically important in standardizing practices in the field. He advised against the unnecessary use of instruments in birthing and spoke openly about preventing women's suffering. He also provided clinical knowledge about women's diseases and treatment. Shippen and his work not only exemplify the beginning of the transition of women in medicine from informal to formal as the 1850s approach, rather the professionalization of women in medicine, but are clear evidence of the standardization of medical knowledge and practice over time. While midwifery had existed as a field whose practices were passed down in a sort of folk tradition since the dawn of time, Shippen pioneered the formal education of both male and female practitioners in the field. In this way, Shippen set the stage for women's role in medicine to further professionalize and for obstetrics to clinically standardize in the second half of the 19th century. Effectively, the field of midwifery and subsequently formal training in the field served as the foot in the door for women into medicine.
In 1850, the Female Medical College of Pennsylvania was founded in Philadelphia near 7th and Arch Streets. It became the first school in the world to train females for a doctorate in medicine in their 2-year program. In December 1851, the first class, which included 8 women, graduated from the college. The class produced Philadelphia's first active female doctor, Hannah Longshore, as well as the first female dean of an American medical school, Anne Preston. In addition to becoming dean of the school, Anne Preston was also professor of physiology and hygiene starting in 1853. In 1861, Preston and friends opened the Women's Hospital Philadelphia to offer medical and surgical care to women by women. The hospital also provided clinical experience to medical students and trained nurses. Preston campaigned for the rights of female physicians and in 1868 even negotiated with the Philadelphia Hospital to allow her female students to attend clinics there. In 1867, the school was renamed the Women's Medical College of Pennsylvania, and 8 years later relocated to a larger site to accommodate for changes in medical education. The college was at the forefront of these innovative changes, including newer and larger chemistry labs, grander lecture halls, designated rooms for microscopy, and it also became one of the first medical schools in the world to adopt a 4-year program. The Women's Medical College of Pennsylvania provided women of all backgrounds the opportunity to study medicine and train to work in various fields. The students had the opportunity to travel to China and India as medical missionaries, and the college found itself teaching females from some of the same countries it was outreaching to. By 1900, 12 African American women had graduated from the college and were practicing medicine. The acceptance and training of minority doctors proved to be of great importance for patients of the like. Minorities who may not have been previously accepted for treatment due to race now had doctors to treat them, and foreign doctors were able to bring Western medical knowledge back to their countries and help improve health conditions of the people in their country, and women in particular. Though a number of positive changes occurred with females in the medical field, women still face difficulty gaining access to medical societies upon graduation. Because of this, the Alumni Association of the Women's Medical College of Pennsylvania was formed in 1875 as one of the earliest women's medical societies. By 1895, they had 300 due-paying members practicing medicine. Many of the same alumni founded a dispensary to offer free care to poor women and children in the Philadelphia region. These women also funded and built a small hospital pavilion with a separate ward for females, providing them with the specialized attention and privacy they deserved. The Women's Medical College of Pennsylvania provided women worldwide with an opportunity to learn and apply medical knowledge and was a starting place for women to prove themselves in the medical field. Joseph Longshore, former professor of obstetrics and member of the college's founding family, left the women with this powerful message. This day forms an eventful epic in the history of your lives, in the history of women, in the history of the race.
In the post-1920s period, we see how the expectations for physicians' knowledge and behavior expand greatly to be more standardized, professional, and academic. It also reveals how much biomedicine has become dominant, but still fails to provide quality care to all sectors of the population. The FOCUS program at Penn Med is an excellent lens to see these themes. Focus on Health and Leadership for Women was established in 1994 within Penn's Perelman School of Medicine. The mission of Focus is to support the advancement and leadership of women in academic medicine and to promote education and research in women's health and women's careers. It created a multidisciplinary network to encourage interest and investment in women's health research. The organization offers paid fellowships, networking events, and publishes breakdown of gender statistics yearly, along with more intensive research about women in medicine and women's health. Focus is a paradigm for the 20th century expectations for doctors' behavior and knowledge. With the professionalization of medicine within the 20th century, by the point that Focus was founded, there is a very codified education, a claim to special expertise, and expansion of knowledge from medical journals. Focus highlights the importance of medical education, fighting for women's rights in academic medicine. Medicine is no longer just a practice of treating patients, but is also an elite educational career, as doctors can be PhDs, scholars, and professors. Focus works not just to help women get into medicine, but for them to work within the established hierarchy to become recognized, respected, and tenured professionals. The fact that there is an organization created solely to promote women in medical academics proves how medicine and research have become intertwined and how critical education is to the profession of medicine. Focus is an excellent illustration of how biomedicine has developed, but still fails to serve the American population equally. From the mid-1960s, the number of female applicants and graduates of U.S. medical schools has continually increased. In the 1950s and 60s, only about 10% of applicants were females, but since the 1990s, women make up about half of medical students. Despite the increase in female physicians and in the development of medicine for women, including safer procedures for hysterectomies, abortions, and birth control, women have not received equal health care in relation to men. There have been many campaigns for women's health to be more subsidized, but the issue is often extremely politically charged. Similar to the Boston Women's Health Collective's mission to help women advocate more for their own health, Focus is working to generate research and funds to improve the state of healthcare for women. Focus on Health and Leadership for Women is a lens to see the professionalization, standardization, and inequality in medicine in post-1920s America. With professionalization and emphasis on education, the advancements did not benefit all groups equally. Female physicians have more equal representation in medicine, but recently, organizations like Focus are fighting for equal opportunity for recognition and promotion. Female patients are also not receiving the same quality of care and reaping the benefits of this new medical knowledge, leading to the fight for high-quality, low-cost women's healthcare.
The role of women in medicine possesses a complicated history not only for females as patients, but as physicians. beginning in ancient times when childbirth comprised the essential function for women in both roles, to the present when women outnumber men as clinical professionals. The female history has been one characterized by a long process of standardization and professionalization both in treatment and identity. This dialogue is clearly evidenced by the involvement of women in the medical institutions of historical and present-day Philadelphia. Overall, their experiences are representative of the broader themes of the history of medicine, which is characterized by the shifting identity of healers, the standardization of medical practice, and the professionalization of the field at large.